So now let's go to management of appendicitis in adults. So management of appendicitis in adults. Principles of management. Basic. Number 1, IV hydration. Number 2, correct electrolyte abnormalities. Okay. Number 3, IV antibiotics. Usually the IV antibiotics we use to be cefazolin and metronidazole. Some authorities also do ceftriaxone and metronidazole, but you get metronidazole to cover, all those gut bacteria. Okay. And then IV analgesics, and you keep the patient nothing by mouth because the patient may go in for surgery, and we do the almighty appendectomy. Usually in Canada, we prefer laparoscopic appendectomy to open appendectomy. So let me take it again. What are the principles of management of a patient, adult patient with appendicitis? Number 1, IV hydration. Number 2, electrolytes abnormalities must be corrected. Number 3, IV antibiotics. Number 4, IV analgesics. And most of the time, the analgesics, they may use opioids. Number 6 or number 5, nothing by mouth. And then call your friendly neighborhood surgeon. Hey, Dr. Obi. Or you say, hey, Dr. Maria. Or you say, Dr. Abosode. Please, I have this patient who has acute appendicitis. I think you need to do a laparoscopic surgery for this patient. What are the complications of appendectomy? They can develop intra-abdominal abscess, and they can also develop appendiceal stump leak. These are two different two complications that you want to learn, you want to master. You want to make sure that you've mastered it very well. Now, this is one unique thing I want you to do with me. And I want to know, if you have a patient who is more than 50 years and that patient develops appendicitis, what is the next best step after appendectomy? Can somebody type the answer for me? I want to see what's the next best step after appendectomy in a patient who is more than 50 years who presents with appendicitis. Beautiful. Dr. Baki, that's beautiful, beautiful. Dr. Freddy, so be specific. You are saying scopy, but be specific, okay? I know you know what you're talking about. So you need to do a colonoscopy. If you have a patient who is more than 50 years, 60 years, 70 years, presents with appendicitis, doctors, please, after you take out the appendix and the patient heals, make sure that you also get the patient to see either a gastroenterologist or a general surgeon for a scope, colonoscopy, in order to rule out an underlying cancer. We are learning the principles, how to ace the MCCQE1 exam.